If you already have Medigap Plan in, or maybe you're thinking about Medigap Plan in, perhaps the thought of Medicare Part B excess charges is a bit overwhelming. In this video, I'm going to share with you how to avoid Medicare Part B excess charges. Hi, my name's Joanne Quinn. I'm co-founder of Remedigap.com and an independent insurance agent here to make Medicare and Medigap a little bit easier, one video at a time. In a nutshell, Medicare Part B excess charges are charges that a doctor can add above and beyond Medicare's approved amount for a procedure or service. These charges come from non-participating providers, and while non-participating providers have agreed to accept Medicare insurance, they do not accept Medicare's Part B payment in full. It's also important to note that as Plan F phases out in the year 2020 for new Medicare beneficiaries, the only plan that will be available to cover Medicare Part B excess charges will be Plan G. So it is likely that there will be other plans other than Plan N that may become more popular, and those plans don't cover Medicare Part B excess charges. So it makes it even more important to understand how to avoid Part B excess charges. Recently, I was asked if there is a limit on the amount that can be charged under Part B excess charges. And while Part B excess charges is also known as a limiting charge, there is not a limit on the number of times a non-participating provider can bill you for Part B excess charges. So in other words, there isn't a cap on the amount that you can be charged for Part B excess charges from a non-participating provider. So let's go through a few easy steps on how to find out if your provider accepts Medicare assignment, and also stick with me to the end of this video where I'll share with you some bonus information on how to find out if your hospital accepts Medicare assignment as well. So the first thing you want to do is go to Medicare.gov's homepage, and on the homepage scroll down to where we see Find Doctors, Providers, Hospitals, Plans, and Suppliers. Right underneath you will click the first link, and we are going to do a search. You enter the location of your provider, their city or zip code, and then you can put in the name of your provider or the specialty that you're looking for, and then search. So what we're looking for is whether or not the provider accepts Medicare assignment. Now, Medicare has made some updates, so at this point it no longer says accepts Medicare assignment. We're looking for a green check mark that also says accepts Medicare approved payment amounts. That is the same thing as accepting Medicare assignment. Now here we've come across a provider that may not accept Medicare approved payment amounts, and the reason we know that is because there's a red circle with a question mark with a statement that says may accept Medicare approved payment amounts. So it's not clear on whether or not this provider accepts assignment. So I would take the extra step and contact this provider's office and ask them if they accept Medicare's approved payment amounts or if they accept Medicare's Part B payment in full. The good news is that a vast majority of Medicare providers accept Medicare assignment. The Henry J. Kaiser Foundation reported in 2016 that 96% of Medicare providers accept assignment, which just leaves a small 4% of providers not accepting Medicare assignment. And as I noted earlier, we are going to discuss Medicare Part B excess charges at the hospital. And I know that sounds crazy because on your Medicare card it says Part A is hospital. So why would we worry about Part B excess charges? Well, while you're at the hospital, your Part A really just covers your room and board, your daily stay. But any medical treatment that you have falls under Part B. So we want to make sure that the services you receive at the hospital are going to be received by the hospital as Part B payment in full, that the hospital accepts Medicare assignment. One of the first things I like to do is check the hospital's website. So let's go through a couple examples of how you can navigate a website to see if the hospital accepts Medicare assignment. Once you find your hospital's website, you just go to their insurance information or financial information and look for Medicare coverage. This facility does a great job of telling you exactly what they take. So this facility accepts original Medicare and accepts Medicare assignment, and that's exactly what we want to know. We can go to another website and let's do a little search here. What you can do on that homepage, if you don't see a tab that says insurance, just type in Medicare into their search bar, and hopefully you'll get a list of options. So this one gives us right away billing and insurance. So we'll select that, and we are looking, of course, for assignment. It does say here Medicare assignment. Mayo Clinic is required to accept assignment for Medicare Part B for certain services designated by government regulations. However, you want to read all the fine print, as we always do, because above that in the paragraph, it says, although Mayo Clinic doesn't participate with Medicare Part B in Arizona and Florida, Medicare will help pay for services provided at all Mayo Clinic sites. So what that is stating is that while Mayo Clinic will take you as a Medicare patient and they will submit your claim to Medicare, and Medicare will still pay their portion of cost, Mayo Clinic doesn't participate with Medicare Part B in Arizona and Florida, meaning they don't take assignment. Now, if you don't have much luck finding out through the hospital's website if they accept Medicare's Part B payment in full, the other thing you can do is actually call the hospital, talk to the billing or accounting department. But when you call, make sure you ask them if they accept Medicare's Part B payment in full. Sometimes if you ask if they accept Medicare assignment or they accept Part B excess charges, it's a little confusing for the person on the other end of the phone. They may not know that terminology. So if you're talking to a billing or accounting department and you ask them, does the hospital accept Medicare's Part B payment in full, you will likely be able to get a clear answer based on that terminology. And what about Medicare.gov? We started there with the providers. Why didn't we start there with the hospitals? Well, if you go on and do a search, you can usually find a hospital that does accept Medicare patients, accepts Medicare insurance, but what Medicare.gov doesn't tell you is whether or not they accept Medicare's Part B payment in full. And that's why I started with the first two steps, which is go online, look for the hospital's website, or call the hospital directly. Since you're doing all the legwork ahead of time, it's going to take a little bit of stress off of you later on if you do need to go to the hospital for a planned procedure or even for an emergency. So keep that in mind, that doing a little bit of legwork on the front end will give you a little more peace of mind on the back end. Which brings us to a really common question that I receive and that you actually may be wondering about yourself. What about an emergency situation? If you have to go to the hospital and a provider is treating you and you can't check them out to see if they accept Medicare assignment, and then you later find out that you're charged as Part B excess charges. Well, that is a risk you take when you have a plan in or any other plan that does not cover Part B excess charges for you. But keep in mind that the vast majority of providers do accept Medicare assignment. And Aetna put out a statistic a few years ago that stated their Part B excess charge bill that they receive or claims that they receive are usually less than $20. Now, if you receive Medicare approved services in any of the states listed, then that means you're protected from Part B excess charges thanks to the Medicare Overcharge Measure law. So if you live in one of those states, that's great news. If you travel out of that state, though, to a different state that's not listed and receive a Medicare approved service, then you aren't protected from Part B excess charges. Likewise, if you don't live in one of these states, but you happen to be traveling through that state, or you live close enough you can pop over to that state for a doctor visit, you are protected from Medicare Part B excess charges in that state. So what do you think? Are you comfortable with the process of finding out how to protect yourself from Part B excess charges? Let me know in the comment section below. Either way. And as always, please continue watching more of my videos on Medicare and Medigap coverage. And if you're new to Medicare, I have a free Medicare e-course. Please feel free to sign up. I have thousands of Medicare beneficiaries that have used this program to guide them through the ins and outs of Medicare. And as always, I thank you for being here today, and I'll see you next time. I don't know why I can't get that out. Wait, what is that? It's right here. Chart. Woo! Wow. And Medigap